First, many thanks for Professor Oliver and Professor Sarah for this good opportunity to learn from you and your team, and as well as many thanks for the local, for the meeting organizer, for the local logistics to have me be here. My name is Duquan Wang from the National Institute of Parasitic Disease, China CDC, based in Shanghai. And Shanghai is a very international and beautiful modern city, so welcome to Shanghai. Today my topic focuses on the malaria control to elimination in Chinese progress, lessons and challenges. So this is my outline: Chinese malaria elimination progress and Chinese lessons and challenges, and for the future cooperation opportunities. So as we all know, China has a long history of malaria, with the historical record 3,000 years ago. Particularly during last centuries, we have around 30 million cases reported every year. 30 million cases reported, as we can see. Yeah. So, in fact, during China, 70 years anti-malaria fight against malaria, we have five stages, based on the 70 years journey against malaria from 1950 to 2020. Yeah. So the first stage is the focal investigation and control, and during these stages, the most challenges from the high incidence and high mortalities and lack of professional agency, and as well as the human resources. So the responses focus on to establish a professional agency and carry out the baseline survey to understand the local situations, to initiate the national malaria program. And the second phase is about the control of the severe epidemic. Yeah. So in these stages, we have a high PY-Wax pandemic, particularly in the middle of China. And in these stages, we have some MDA as well as protections for those high risk populations, as well initiate some joint control and prevention. And for the third stages, is to reduce malaria incidence, and in these stages we have the such as the high epidemics in those remote areas such as Yunnan and Hainan province, as well as stable epidemics. So in these stages, the strategy we use the comprehensive integrated strategies, which means we strengthen the vector control as well as the case management, particularly in those high-risk areas and high-risk populations. And for the fourth stages, the main purpose is to consolidate the efforts, consolidate the control efforts. And in these stages, main challenges come from the high-risk areas, from Yunnan province and Hainan province, as well as a big resurgence outbreak from the middle of China, such as from the Anhui province, Henan province, Hubei province, as well as Jiangsu province. For these stages, we put more efforts for the case detections, as well as the better net coverages, as well as to improve the surveillance, monitoring, and evaluations for some key activities. And for these stages, we have got a big support from Global Fund to push the malaria control efforts. And therefore, and particularly for these stages, we have established a real-time web-based reporting system since 2004, after the SARS outbreak. As we all know, we have a big SARS outbreak in China in 2003, and after the SARS outbreak, we have got a big support from China government to establish a real-time web-based reporting system. So I think this is a very big step, very big improved to reach the real-time reporting of a malaria case in the whole country. So this, based on the great progress of malaria control, in 2010, we initiated the National Malaria Elimination Program. As we can see, to support the National Malaria Elimination Program, and 13 departments working together to support the national plan. So including the finance department, the education department, and the transportation department, 13 departments working together to support the national plan, as well as we have a different strategy to support the national malaria elimination program. As we can see, we have divided the malaria epidemic areas into 4 types based on the malaria incidence during 2006 to 2018, based on the incidence, the local incidence at the county level. So as we can see, for the type 1, which has the highest malaria incidence, and we use the integrated interventions and management of weather control, we have strengthened the interventions on the weather control and the case management. And for the type 2, we have focused on the reduce the source of infection, And for the type 3, we focus on the surveillance and response, particularly for those imported cases. And for the type 4, which has no local cases, we strengthen on the case management to reduce the deaths. So as we can see, since the malaria elimination plan, since 2010, the local cases reduced sharply. The local cases, as we can see, in 2010, around more than 4,000 the local cases, and then the local cases reduced sharply with the greater support, malaria elimination goal. As we can see, the last local cases reported in 2016, and since 2017, no local case reported in China. As well as we have promoted and the malaria elimination certification step by step. As we can see, we started the malaria elimination certification from the county level, and then to the prefecture level, and then to the provincial level, and lastly to achieve the national level, the malaria elimination certification goal. So for the country, the national malaria elimination certification was achieved step by step from the county to prefecture to the provincial, and then to the national level. So the second part about the lessons. Yeah. So the first lesson we would like to share, the government ownership and leadership will be very, very important, which will not only provide the sustaining financial resource, but also very important to mobilize some commodities and resources, as well as technical resources, particularly to build a technical team and extra team to support the national plan going on well. And also we have done a lot of community mobilization and empowerment, involvement of this national plan supported by the government. So government is very strong. They can do everything, mobilize almost every resources. And the second lesson is we would like to share that because China is so big, and different areas have different parasites, different vector, and also during the 70 years fight against the malaria, we have different malaria picture, and we have different malaria during each stage we have different challenges. So we have very specific strategy, and to align the local, to fit the local conditions and local different phases. So we basically we have a stratified, sorry. We have a stratified based guidance and strategies, as well as we have the experience of the joint control and prevention. Although we have a national goal and a national plan, but the implementation protocol was organized basically at the provisional level. So basically the provisional CDC will lead and responsible for the implementation protocol, but in those particular areas, such as the middle of the China, the 5 provinces working together because of the similar malaria situations and the similar social, economical, environment, and the culture. So they are working together through the same protocol and the same goal and the same strategies. And also they're learning from each other, understanding each other. They break through the administration barrier. So this is the Chinese. In fact, we initiated this joint control and prevention since 1970s. Until now, they are still working together. Even they are working on the post-elimination surveillance. So this is Chinese. I think is a very good lesson, because at this particular time, almost 80% cases of the whole country come from these areas. So for these areas, the 5 provinces, they are working together to reduce the malaria burden quickly. And also, we have experience for the operational research and the pilot. Normally, if we try to develop new interventions, new tools, we have experience to start from some pilot research and a pilot project to generate some evidence as well as lessons, and with the best practice and lessons, and then we will scale up. We will scale up the best practice step by step. So in China, we have some experience to start the pilot study firstly, and then scale up to some similar areas step by step, as well as we have also done a lot of research and innovations for the diagnostic and for the drug development. And also we have some lessons for the capacity building. As we can see, we have done a lot of efforts for the institutions, capacity building and human resources strengthening, and later working, particularly for the information reporting, and the quality control. This is everyone knows that financial support is always very, very important, and we already got the continuous support from the national government as well as from the local government. local government normally will provide the matching fund according to the actual situations. So although we have achieved the malaria elimination goal in 2020, but we still have a high risk in the border area, particularly in the China-Myanmar border area. China-Myanmar border area has around 2,000 kilometers. So this is also the last area for malaria elimination in China. But now we still face a big challenges for the imported case, particularly the bigger challenges of the local transmission from the imported case in the China-Myanmar border area. So I will share some more details later. Yeah. And also we have experience working together with the international colleagues for international cooperations. So here I would like to share this China-Tanzania malaria cooperations. In fact, we initiated this cooperation 10 years ago, since 2013, and we already working together with WHO headquarters and country office to design the strategies for the China malaria cooperations. And during 2015 and 2018, we completed the China-UK-Tanzania pilot project supported by former DFID, and then we initiated the China-Tanzania demonstration project supported by Gates Foundation, as well as we started the China-Africa Malaria Cooperation Project supported by China government. And particularly in 2022, we started the scaling up of the China-Tanzania project model 17 MRCT, and WHO headquarters take the results from China-Tanzania project and then scale up these results model into other countries, into Senegal, Burkina Faso, and Zambia. And now we are working together we are prepared to working together with the Swiss government to initiate the China-Swiss and Tanzania cooperation project in Tanzania. And in this project, I think we share some Chinese experience and concept, particularly as most of our colleagues here know the Chinese 137 model, but we share the concept and the practice of 137 model into Africa local context, and we develop a local innovative local adaptive strategy 17 MRCT approach, which means malaria reactive community-based testing and response approach, such as 1 day means conduct data collections and analysis through the local existing health facilities to decide the hotspot areas and priority cluster for the interventions. And 7 days means identify hotspot mobilization, testing, and treatment. So this is an innovative strategy developed from China-Tanzania project. I think we have shared some Chinese concept and practice, but we cannot copy Chinese model, copy Chinese experience into different situations, because China, Africa have different malaria vector, different malaria parasite, and different health system, different environment. But from here, what's the experience is that we can share some concept, we can share some and practice from China, but we need to adapt. We need to adapt Chinese experience into local context. Okay. So this is what we have achieved from this model. As we can see from this innovative strategy, the malaria prevalence was reduced from 38% to around 3%. So here, this is our project areas in Tanzania. And at the starting, the project areas is the red, the color is also red, is similar to the surrounding areas, around 38%, and then it reduced to 3%. So this is the post-elimination challenge, as I just mentioned, the prevention of the local transmission from imported cases, particularly between the China-Myanmar border areas. As we can see, although we achieve the malaria eliminations, there every year we have around around 3,000 imported cases, 3,000 cases. For this, during this past 3 years, because of COVID-19 pandemic, the travel limitations, so less imported cases. After the pandemic outbreak, we can see more than 2,000 imported cases. So this is the imported cases in China. As we can see, most of the imported cases are PF cases. The second, about 20% cases are PYVACs, and more than 80% cases, imported cases from Africa. And for the imported cases, the PF cases mostly come from Congo, Nigeria, Guinea, Cote d'Ivoire, and Ghana. And for the imported PYVACs, first come from Myanmar, our neighbor countries, and the second from Ethiopia, Congo, Pakistan, and Papua New Guinea. And as we can see, the bigger challenges from Myanmar side. This is from the number of malaria cases in Kachin region in Myanmar side. As we can see, the cases reported. The reported case increased sharply. The number of malaria cases in the border areas of Myanmar was around 227 in 2023, while currently this year it is estimated around 10 more. Sorry. This year, it is estimated 15,000 cases. 15. So the cases from Myanmar side increased sharply. As well, in China side, the border county, Xinjiang County, also increased sharply. Yeah, and also we have a lot of cross-border mosquito-borne malaria cases reported in these particular counties. And the last part about the challenges. So I think the first challenge is about the identify the social infections. As we all know, we have around 3,000 imported cases every year, and 80% of the imported cases from Africa. And particularly in a lot of Chinese migrant population working in Africa, and for this migrant population, they have a lot of traveling, such as within 3 days or 1 week, they can travel from Tanzania to Burkina Faso and Senegal, and then back to China. And when they back to China, they got a fever, they were diagnosed with malaria. But it's difficult to identify whether they got the malaria infection from Tanzania or from Burkina Faso through the travel history. Because these people, they have a lot of traveling. So I hope maybe in the future, we can use the genetic evidence to help to identify the source infection. The second is about the drug resistance surveillance, because when I have traveled in Africa, I already met some questions from a Chinese medical team working in Africa. They always ask me why they cannot cure the malaria case through a full complete treatment. Normally, sometimes they have to take they have to take the second round or third round of full treatment for the radical to cure malaria cases. So although there is some malaria surveillance or drug resistance surveillance project going on in Africa, but I am not sure whether they can answer these questions well. So I hope, particularly during the China-Myanmar border areas, during the past 4 or 5 years, because of the COVID-19 pandemic, because of the interruption of the joint control and the prevention efforts, I think there is also lack of good surveillance of the drug resistance, particularly along the China-Myanmar border areas. And the last challenge from the diagnosis, as we can see here, for the imported case in China, every year we have around 100 severe cases and death cases. And most of the severe cases and death cases come from the misdiagnosis and mistreatment through the currently routine the malaria diagnosis tools, through the microscopy and through the routine rapid diagnosis testers. So I'm not sure whether the current diagnosis tools or strategies can work well to identify the imported case from Africa, from different countries. Should we consider to update these tools and strategy through the genetic tools? Yeah. So I am sorry, it's a bit over time, so I just a quick presentation. Thank you very much for this opportunity. Thank you. Yeah.
Thank you very much, Dr. Duquan. This was very informative and very comprehensive. So can I take some questions from everyone? Okay.
Let it fun.
Thanks for very nice experience from China. And I would like to ask, we all see the achievement of China in malaria elimination, but I would like to ask, in which case that you think that if you apply the genetic surveillance in the previous year will be more strengthened to reach the target of elimination sooner?
Sorry? For the elimination goal?
In case that you apply the genetic surveillance in the previous year,
yeah.
Do you think in which case that do you think that will be the quicker effort to eliminate malaria in China?
So if you were to do it today and you have the genetic technology available, what use case would be impacted most, right?
Okay, so based on my understanding, I think particularly in China for the malaria elimination goal, when we started the China National Malaria Elimination since 2010, at that time we don't have a specific strategy through the genetic tools to support the national malaria elimination progress. But we try to use some genetic tools to understand the source of infections, particularly for those imported cases from different areas, from Asia and from Africa. And we also have established the national malaria reference laboratory work, the whole laboratory based on the 24 provisional CDC labs. And for this reference laboratory network, the main purpose for the quality control, such as to identify the parasite species, whether it's the PV, whether it's the P overlay, which is normally is difficult to identify through microscopy or through the rapid diagnostics. But for my understanding, for the post-elimination surveillance, we have already achieved the malaria. The genetic tools will be very useful and helpful, particularly for the post-elimination surveillance as well as response. I think definitely, particularly we already face several bigger challenges, as I just mentioned, such as the first identify, so the second about the drug resistance, as well as the diagnostic resistance, which should be very useful and helpful through the genetic tools in the future. Thank you.
Dr. Duquan?
Yeah. Yeah, thank you so much, Professor Duoquan. And I'm very grateful and congratulations for your achievement in the malaria elimination. And especially you also you have a sustainable factor for keep the result up till now. I have three questions for your night presentation. Firstly, in your country, in the central China, where is the where blood virus prevalent, and up to now, on the species elimination, how to keep or how to prevent sustainable to prevent the relapse of the blood virus in your country? The first question. And the second question, up to now, you have an achievement about the elimination certification. Every year, any medication you use for rotation for prophylactic or not? For example, chloroquine, for example, ACT, rotation for that. And the last question from me, I think I would like to know about what kind of the ACT in your country are using. What kind of ACT?
Okay, thank you.
Congratulations.
Okay. Thank you. I will try my best. I work for the malaria epidemiology. I think the first question is a very good question because in China anti-malaria history, most of our Chinese parasite from the PY virus, and PF is very few, only limited in some particular area in Yunnan province and in Henan province. So more than 80% of cases in China are PY virus, particularly in the middle of the China. During last century, the biggest outbreak and most of the outbreak are PY virus in the middle of China. So this is, I think, also a big challenge is for post-elimination surveillance in China to consolidate the malaria elimination efforts, because the China, most of the malaria transmission vector is the Anopheles sinensis, Anopheles minimus, Anopheles dirus. Most of the areas are the most widely mosquito is the Anopheles sinensis. Anopheles sinensis normally is sensitive to PY virus, but not sensitive to PF. Currently, most of our imported cases, 80% imported cases are PF. So we are not worried about the PF, the risk of local transmission from the PF imported case based on the local malaria vectors. But if we have some imported cases, such as PY virus imported cases from Africa and from Asia, we are worried. We are worried about whether there should be some risk of local transmission for the imported PY virus, based on the local malaria vectors, because the local vector Anopheles sinensis is the more sensitive, PY virus. So this is the case. What's the second question?
So there was part of the question was about how to handle relapses, right? Because obviously that's a major issue with Vivax. Not so much a reintroduction, but the relapses. Yeah.
Okay, so for the treatment of PYX in China, I think have a bit different from WHO guideline. As you see, WHO guideline normally is based on the 14-day treatment. 14-day treatment PYX. In China, we use the 8 days. 8 days treatment of PYX, chloroquine plus primaquine treatment for the PYX, but plus the spring treatment. Spring treatment, that means for the PYX cases during the spring festival, most of the cases when stay at home, and we will conduct a second round treatment based on the 8 days, chloroquine and plus primaquine. So I understand that in fact we have 16 days, two rounds of the 8 days treatment for PYX. So that a bit different, a little different from WHO guideline. WHO is 14 days. We have 8 days and plus 8 days, treatment.